So motivational interviewing is an evidence-based practice that helps people to transition from being really ambivalent about what they want to do into being able to make some positive decisions for themselves. So often clients are come into treatment and they're really stuck in a place of, I haven't done anything right, I can't get clean, like they have these negative thoughts about themselves. And motivational interviewing shows them that they actually do have the answers within them. And so they're able to make choices that are healthy and good for themselves. So it's really about the clinician's interaction with the client that helps to elicit that information from the client. So it's, you ask open-ended questions so that the client can't just say yes or no. They actually have to elaborate. And as they elaborate, they find out that they have the answers already. And it gives the clinician an opportunity to point that stuff out. So, yeah, you had the answer. You have some experience in staying clean in the past. And so then the client feels like, yeah, well, I really do have that experience. I have stayed clean before. I do know how to go to meetings. I do know how to ask for a sponsor. So it shows the client that they do have some of the answers on their own. And they do know what works for them and what doesn't work for them. So it's an interaction between a client and a clinician, or actually anybody can do this. So like a recovery specialist can have a motivational interaction with the client that shows them that they are doing well, that they have the answers, that they know the next right thing to do. And so it encourages them. When you come into treatment, your self-esteem sometimes is through the floor. And so knowing that you have the answers builds that a little bit. And then when you have another answer, it builds it a little bit more. So it just develops into something that's positive and good.